Nursing home COVID outbreaks are on the rise. Down in Laois, there is a reported 31 positive cases in one nursing home alone. But how do we stop the spread? And are we at risk of making the same mistakes we made in the first wave? Diarmuid O'Dalaigh, who is the owner of Oaklodge Nursing Home in Cork, joins me now. Diarmuid, you are somebody trying to run a residential nursing home in the middle of a pandemic. Half the deaths, more or less, in the first wave were among nursing home residents. Is there a culture of fear among nursing homes now?
Thank you, Ciara. Yeah, I think we're extremely nervous coming into with the numbers rising and knowing that the most vulnerable people in the country reside in nursing homes up and down the country, and it's devastating news what happened yesterday for the families, residents, for the staff and the management, who I presume have all done their level best, like the rest of us, to keep this out. So yeah, we're all very nervous and looking at what extra steps can we take. We have HIC COVID assurance, so it's examinations done, as it were, and fulfilled. We're looking and following all the HSE and HSBC guidance, looking at what else can we do, and it really comes back down to the constant hand washing and hygiene, PPE, and social distance for our staff, and unfortunately lockdown or suspended visiting now, except for critical care.
We are in a different space though than the first wave. In the first wave, the advice from NPHET was not to wear masks in nursing homes, even though it should have been, and even though on Lunchtime Live we called for it. Also, there was a lack of PPE in the country in general at the time, which caused you problems. And indeed, more criticism of NPHET. They were slow to close the nursing homes. We called for it ahead of them as well on Lunchtime Live. Do you think now, with hindsight and with the, I suppose, added understanding we have around this, so you have the PPE, you're wearing the masks, and you have, as you say, closed external visitation, which is sad for the residents, no doubt. Do you suspect, or do you hope this time around things may be different and we might be able to better protect our elderly?
Yeah, we are hopeful. We've all learned and been on a journey of learning, really, the whole country, and including nursing homes over that period. And yes, we are very hopeful, but as you know, it just probably takes one person to introduce it, and it can spread like wildfire. We are got into internal lockdowns as well to keep people distant inside and that. But yeah, it is.
So you're keeping different groups apart, different pods within the nursing home?
Yeah, all, I suppose, smaller sections. We have 4 smaller sections, and trying to lock down the doors pretty much between them, make sure they eat in their rooms again for the next few weeks and all of that. We had gradually reintroduced some of that, while we were maintaining a certain amount of distance. We hadn't actually allowed any external visitors into the house, and now that will continue. But we had some outside covered visiting, and that will stop now as well.
Okay.